I'm live. Hello. Hello, everyone. This is so cool seeing you on the comments already. I was trying to like scroll through them right now and I was getting hooked up here. How are we looking? We're okay. Everything's in frame. Tried to wear this like little nice sweater. Let's see here. Let's see here. Okay. Okay. I'm so happy we're doing this. Like, thank you for being here. I'm gonna, before answer, so I saw a lot of questions on the YouTube community post that I did. So I got those all laid out right here. And then I have a bunch of questions from Instagram that I got all laid out over here. It's like I'm showing my screen. I know you can't see the screen, but I'm gonna try and get through all the YouTube ones first that were pre-asked, because we're here on YouTube. I'll ask some Instagram ones. And of course, I'll be looking at the comments here to make sure if anyone has any questions while we're live here. I'm so excited. Let me know where you're all from while we're waiting to start. I have someone from Scotland. Super cool, fun, happy guy for sure. Oh my goodness. The UK, Canada, everybody from different countries. I'm in Chicagoland. Um, so I'm in the US. Australia? Nuh-uh. Really? Arizona? Okay, so Arizona, I'm going to school in Arizona right now, so it's all online, but my graduation will be in Arizona, so I'll be there in May. So I have all of these amazing. Okay, so now we got another Chicago. Hello, Paxton. Chicago. So not too cold out today, right? However, I do have my little space heater on me, and I hope it's not too loud for the audio, but I kind of need it on me because I'm freezing. So, and I know it's not even that cold today here. But do you all think, okay, cool, we're almost, oh my goodness, more and more people are joining. Yay. Okay. Once we're like, oh, I just realized I thought that was the minute. Wait, what am I looking at? I was trying to figure out how long we've been on. Maybe that is it. I was gonna say the 2 minute mark, but maybe this is the 2 minute mark. Regardless, let me know. Do I have a thick Midwestern or Chicago accent? Y'all think that's true? Because I'm working very hard to sound just American. I'm trying to not sound Chicago anymore. Just the way I said Chicago, right? I'm trying to sound Chicago. And I'm working on that. So you all let me know if you think, I don't know, if you've followed along for a while, my first videos, I think, oh, the way I'm saying, that don't you know? I feel like I'm working very hard to not sound as Chicago because I want no one to know where I'm from, even though I always talk about it. Okay. Anyway, let me know in the comments. But I think it's time. We'll start. Let's just start with the first question and people can trickle back in. And when you can always watch this later if you missed the beginning as well. I'm so excited. Okay, so I'm just gonna scroll through. There was one that I thought was like I was trying. Usually, did I already say this? Oh my goodness, my mind. It's been a long day. So Monday, right? I usually have a Word document where I write out all the questions. Didn't do that today. Yeah, I was explaining at the beginning how I have this and this. So they're all over the place, and I didn't really read them all like I usually do. So this is the most live of live you're ever gonna get of me. Maybe if it goes well, I'll keep doing it this way because it did save me time. But hopefully I answer the questions well. This is very, very impromptu ad lib. The first question was something so easy and good. I was like, oh, I can handle this. And then we'll get from there. We can dive into the teeth, right? But now I can't find it. It was something about like, why did you hold on? Get cozy. If you're sitting down, get nice and cozy. This was it. Please talk. Okay, this was Anna Lee 111. Please talk about how you knew you wanted to go into dental hygiene instead of being a dental assistant, an ortho assistant, dentist, etc. That's a good way to start. And I got distracted by heavy thought of auditioning for movies from Anon. Oh my goodness. Yes, we'll talk about that too. Okay, but back to why I chose dental hygiene. I personally thought I thought I was going to be a dentist. I wanted to be a dentist. I did my undergrad, biology and chemistry. I studied to be a dentist. But then I never applied to dental school, right? Because during my undergrad, we had to shadow dentists. And as I was shadowing dental offices, I'd be watching the dentist and I always found myself like watching the hygienist instead. I was so interested in what the hygienist was up to. I think mostly due to the preventative aspect. So long story short, I can talk about this for the whole hour, but long story short, I just really love the preventative aspect of dental hygiene. Restorative dentistry is amazing as well, but I just really love trying to prevent things from needing to be restored, right? Preventing cavities, preventing gum disease. So I was so interested in that, and that's what got me into dental hygiene. Having said that, in this question, they also asked why not a dental assistant, why not an ortho assistant. I also loved dental assisting. I was a dental assistant first, so but I did it kind of different. It doesn't matter. But I was already in dental hygiene school, and I was like, wow, I don't know a tooth from a toenail. I need to like work somewhere because I knew, you get so much more from experience than from school, right? Of course, you learn the basics in school, but being in the workplace is like nothing can compare to that. So once I went to the workplace, I was a dental assistant as I was in dental hygiene school. So I love dental assisting as well. And truly, you know what? For the first year, I did both. I would assist like on a root canal, and then I would like have a patient that needed a cleaning, and then I'd go be the hygienist, and then I'd go be the assistant. And I actually loved going back and forth. It got really complicated with paying me, right? Because like I would get the hygiene salary, then I'd get the assisting salary, and it was like I was doing like a commission. It made it easy. It was just all over the place. So I had to choose one. But if I to this day I still if the dentist ever needs help, I'm like, you need an assistant? You need help? I'm around. If I do have time, I love assisting. I thought it was so cool. You see a lot of cool stuff. Okay, so I answered that, and someone said, have you auditioned for movies? Or no, have you thought of auditioning for movies? Yes, absolutely. I always think in retirement, I really hope to be like an elderly actress or something, like an 89-year-old who they need in a movie, an 89-year-old old granny. And I'll be like, me, that's my hopeful retirement job. I know it's a weird answer, but I'm just trying to answer all yes, I love it. I worked on Chicago PD, the TV show for a while. Um, I was, yes, into acting. And also, that's another reason, back to the first question, why I really chose dental hygiene at first as well. I have a video about this. It's called like why I chose dental hygiene or why I became a dental hygienist. You can search it on YouTube, put teeth talk with the end of it. And you can see, I explain how like I was going to go to dental school, but I really wanted to be an actress. And like I had a lot of friends moving to LA or moving to New York to pursue acting or Broadway. And I was like, should I do that? And I didn't want to commit to dental school, and I was freaking out. And so when I was in dental hygiene school, I was able to kind of do both. Not that dental hygiene school is flexible at all. I honestly don't know how I did both, but I did a little acting. But now I get to get the energy out here on YouTube. So it like all comes together if you really think about it. Like now I'm not acting, but I still get to be because I am a hygienist, so I'm not like acting like a hygienist. But on some of my skits, what that we do right here, if you follow me on Instagram, I get to act in those skits. We act out little dental skits, and so I get my energy out doing this, and I love it. Someone said, okay, good evening. Your thoughts on the Smile Direct bankruptcy? Very topical. I love it. Yes. So I was talking about this on Instagram, and I have a video all about, yes, I knew that they were getting sued for a long time, and I made a video about that. We're talking about Smile Direct Club, the clear aligners that you used to do at home. They filed for bankruptcy, and they just quit. They shut down, and they're leaving patients high and dry. And I did do a video about how I had a feeling that was going to happen sometime soon because I saw how many organizations and people were suing them. They had a lot of lawsuits out, so it looked kind of bleak. So I feel very bad for people that were in the middle of treatment and now they're like, shoot, what do I do? So I guess my best advice is to definitely call your dentist and or see if they can help you out, or if they can refer you to an orthodontist that can maybe help you out. You might need to start treatment over. If you're almost at the end, maybe they can help you out at the end. I'm not really sure. It's such a, I don't know, random, unique situation for everyone. And I really feel bad for someone that's paid and now they're not getting their aligners. That sounds awful. But no, I've never promoted them because I've been de-promoting them my whole career. But a lot of people didn't know. And and it stinks, They got you. They had some good marketing, the good advertising. Okay. Okay. Here we go. Hey, it's Foxy. I get so excited. Thank you. I have a YouTube membership here. When you like subscribe on YouTube, thank you all for being here and subscribing. When you subscribe, there's like a subscribe button and there's like a join button, and you could join the YouTube membership. if you don't know what that is, there's different tiers. And the first tier is my toothy supporter, where you get like loyalty badges. You get an emoji, special emojis that you can use for the comments, which is really exciting. I think they're so cute. And you get priority reply to comments. And then for the toothy community, you get perks from the previous levels, and you also get a behind the scenes content video. And then for the tooth enthusiasts, or the toothy enthusiast, tooth enthusiast, that highest tier, you get a personalized thank you gift and all the stuff from the previous level. So if that's something you're interested in, check out the join. Okay, so let's see what else we got for our questions. I see like a lot of please answer my question. Shoot, I didn't see your question though. Let me know your question. If it says please answer, I can't find what it was. I really want to answer everyone's question. This one's really interesting. R Sutton 06. I don't know if this is a question. I'm trying to read it as I talk, so I'm just going to read it out loud. Let's all do this together. Could you talk about how important it is to use peer-reviewed scientific studies when making clinical decisions? I am a librarian, and I could use some help convincing dental hygiene and dental assisting students to use scientific studies and data when researching clinical questions. And I love your videos. Thank you. Thank you for being here. Okay, Arson, I love it. Could you? So what's the? So could you talk about how important it is? It is so important. Everything I do here on this YouTube channel, all of the information I get is from the American Dental Association, the American Dental Hygiene Association. All of their stuff is from peer-reviewed scientific studies. If I'm not getting it from their association directly, I am reading my own studies, making sure it's not just one. If it is just one study that suggests something about your teeth, I make sure to tell you that this is only one study. That doesn't mean anything. You know what I mean? Like versus 500 studies that have all proven this or shown this. So I try to be really clear about like, if it's not proven by the association, I just try to tell you how it is. You know what I mean? I always like to think that I'm like very neutral, that I'm all about the holistic stuff, but I'm also all not about it. Like I'm very on, a lot of it looks great, right? Some of that holistic stuff doesn't have that much research. So that's why we're like hesitant on some of that stuff, because we don't have 500 studies. We might have one study versus, you know what I mean? You guys know what I'm saying? So I think that's, to answer R Sutton's question, could you talk about how important it is? I think not only is it important to use peer-reviewed scientific studies when making clinical decisions or making videos or telling people about what you learned, but it's also very important to really explain the background of the studies you're using. Was it 3 patients in Chicago, Illinois, or was it 300 or 3,000 patients throughout the nation or throughout the world? So I try to really make sure any study on any product, I really reveal it all, because that's what it's all about. And that's what I do one-on-one with my patients in the op, cleaning teeth. I do that same thing with my patients as I do here. So Patsy, a member for 23 months, almost 24 months. Also on the member joining the community, you also get like different colors next to your teeth, depending on how long you've been a member. You wrote a exciting thing. Let me see. Would you rather run out of toothpaste or run out of floss? I wanted to say right away, run out of toothpaste, boom, tap, keep going. But like you need to if I needed to choose, and I'm not saying this is right, but if I was on a deserted island type thing, I would 100% have my toothbrush and my floss. Because at least you're manually removing the plaque and tartar, or you can't remove tartar, but you're removing the plaque so it doesn't turn into tartar, blah, blah, blah. However, without the toothpaste, I'm not remineralizing and I'm not strengthening and I'm not preventing cavities. So that bothers me. But I'd rather not have toothpaste than floss, because you need to be cleaning that between your teeth with something. That was one of those, like, if you had 3 things at a desert island, what would that was funny, Patsy. Abby. Okay, Abby. Hello, thank you. I don't know what the balloons, number 1. I'm sure you didn't just turn 1. It looks like a first birthday on this thing. Maybe it's because your first comment, or I don't know, but I love it. Okay, so my husband's work is dropping dental insurance for 2024. Okay, do you have any tips for how to reduce dental costs with no insurance? Yes. Okay. So here's the thing. I always say prevention is key. If you don't have dental insurance for a year or something, still go. The amount of money you're going to pay just for a cleaning and exam, maybe you need x-rays, is nothing compared to if you skip a whole year or skip a couple years and then see what happened, then get your exam. That could be a really pricey appointment if you could have prevented things when they're small, non-insured. You could pay maybe, I hate to use numbers, but let's say it's $100 for all that stuff. I know it's probably going to be more. It's probably going to be like 200, but say it's $100 to prevent everything you're paying out of pocket. Say it's $1,000 to do all your fillings and cleanings and deeper cleanings, things that you would need if you were to skip that $100 appointment. You know what I mean? You like invest in yourself. If you cannot invest in yourself, there are other options. I do have a video that goes all over. It's called Affordable. I think put like no insurance teeth talk girl. You could type that in and you can find my video. Another option, this one I really love. I used this all through high school. If you're able to pay something, but you're a little stressed without insurance, you still want to have something there that makes you feel more insured. There's something called dental plans. And hold on, I'll find it. Let me scroll through. I have it on my website. Like they're called like discount plans. So what you do is you pay like say the $200 or something for the year, and they're all different, but this is just an example. Say you pay for the year, it's like $200 and it'll cover like 2 cleanings, 2 exams and 1 x-ray or something for the whole year. And so then you just paid for it through your dental plans and now it covers everything. You don't like, it's a really nice, the best part is that it also gives you like a percentage off. So say you do need a filling, this is why it's a little better than paying out of pocket doing these dental plans. It's better because if you do need a filling, it usually offers like 15% off or 20% off or something percent off. So it's going to be cheaper. You know what I mean? Because you did it through these dental plans. Hold on, I'm typing in. I found it on my website, teethtalkgirl.com. Of course, you can find it, but hold on. Maybe this is the direct link. Does that work? Can you see it in there? Let me see if I can pin it. So these are, I hope that works, but it's dental discount plans, Teeth Talk Girl. You could go to my website and check those out. Like I said, just see, someone says they see it. Cool. If you see, like I said, I used these all through high school and it was so great because I remember I did need a filling once when I was in high school and I was like, oh no, I don't have insurance. And then my dentist was the one who told me about it. Was like, hey, get the dental discount plan and then it'll give you like a percentage off. You know what I mean? So I was really, really happy. My dentist told me about it and now I can share it with everyone I talk teeth to here. You know what I mean? There's a bunch of different plans. You'll see which one works for your dentist or your area. So you could check that out. So yeah, if anyone's used those, let me know. Here, I pinned it. I think I did it. I'm trying to get all technology savvy here. Okay. So yeah, that helps a lot. So yeah, no worries, no insurance, no problem. I think that's what my video is called because truly dental insurance barely covers anything unless you're really having extreme involved work. If you're just getting like cleanings, definitely do the discount plans. I think it's worth it. Okay. Let's talk about this is really nice. The way this person started it is so nice. Okay. Hi, Whitney. This is Zach B5787. As a future dentist and huge fan, thank you. I'm thrilled to join this live stream. This is already, thank you. You're boosting my self-esteem. Your insights are always so valuable. I'm curious, what's your favorite dental procedure aside from the amazing world of root canals? You remembered I love endo. Also, I've always wondered, do you have a preferred type of gloves for procedures? Thanks for being such an inspiration. Yes, I love root canals because they're so interesting. It's so interesting when you could, especially if you are working with a microscope. I mean, obviously I'm not doing the root canals, but when I was an assistant, I could watch what my boss was doing. And it was like really, really cool to see in the canals with this wild microscope. So I loved them. But no, I would say my second favorite is probably fillings. Simple, like not that fillings are simple, but yeah, a cavity, removing the decay, filling it up. I remember loving passing everything like etch, this, that, doing the handoff. I loved fillings because they could be really quick. You could really, especially if you're a dental assistant with a dentist, you could really get a groove together. Like the two of you are tangoing. I loved fillings. And then the gloves, what's funny about the gloves thing? I used to think I was allergic to nitrile, like nitrile gloves, which are the ones that everyone uses because latex is like the more likely to be allergic to glove. Like there's latex and there's nitrile. So like latex, not everybody, but kind of like peanuts. Like people are more likely to be allergic to latex, so nobody's allergic to nitrile. But I used to have trouble with nitrile when I worked in a science research lab. Back shout out to the lab I worked at. I just had lunch with them yesterday. I love them all. One person I was working with is actually a dentist now. she Anyway, I saw them yesterday. But yes, we used to have to wear these big, like heavy duty nitrile gloves because we worked with hydrofluoric acid, HF, and they were like thick. They went up. We wore these like astronaut looking suits. Anyway, I used to get these bumps all over my arms, and I thought it was the nitrile. So when I got to become a dental hygienist or dental assistant, I was afraid to put the nitrile gloves on. I was like, no, I'll always use latex. But then when I had a patient who's allergic to latex, I was like, I have to try the nitrile, and nothing happened. So clearly, I was not allergic to nitrile. It was probably something else in those big heavy duty gloves that bothered me. Anyway, that was a long story, but if you wanted to know. Okay, let's see. What else we got? I want to answer some questions. Okay. Excuse me. Could you please talk about tooth erosion and acid reflux? Yes, very much related. Tooth erosion, acid reflux. Acid reflux can create tooth erosion. So if you're getting sick a lot, throwing up, if you just have acid reflux, right? And any type of acids in your teeth are going to erode your enamel. So that's the word in itself, tooth erosion. So if you suffer or you're struggling with acid reflux or anything of that sort, my best advice, sorry, my nose, I feel like it was running. My best advice is to always rinse with water when you feel something like that coming on to help neutralize the pH in your mouth. Something else you can do is chew xylitol gum, suck on xylitol mints. Xylitol, it's with an X. It's like in a lot of sugar-free gum. Excuse me. I just don't want you seeing like something. Ugh. I used the neti pot yesterday because I was just trying to stay like healthy. And I'm like, this is, because it's like the holidays. And I don't know. I think the neti pot, obviously did something, but I was like, maybe I shouldn't have done it. Anyway, so sorry about that. Yes. So just always try to protect your teeth. Keep them keep it as neutral as you can in your mouth if you're dealing with anything like that. I do have a video that's like how to prevent tooth decay, how to prevent cavities. Actually, I have one that I think that says how to prevent acid erosion on your teeth. So I give a whole list of ideas on different things you could try. But the long story short, just to keep it a quicker answer for this is keep your mouth as neutral as you can. Don't eat like acidic foods, like overwhelmingly a lot. If you are struggling with acid stuff, you want to stay away from acid in your mouth. That kind of answers mostly. Okay. Okay. Chaka Boom 5. What is the best way to whiten teeth at home for a person who has sensitive teeth? Okay. So this is probably the number one asked question when I'm working chairside and now cleaning teeth with my patients one-on-one. Like, I have sensitive teeth. How do I whiten? I feel so you're on to something. Lots of people ask that. I probably should. I don't think I have a video like specific. Thank you. I'm gonna make a video now all about that. How to whiten with sensitive teeth. I have how to handle sensitivity after whitening, so it's kind of the same video, but I could make it more specific. So basically, what you have to do is don't power through it. If you are, I'm getting a notice that says ads will run shortly for some viewers. What does that mean? I don't know what that means, but in 48 seconds, if it cuts me off and plays an ad, I'm going to have to figure out how to turn that off. I've never had that. I've done a few of these lives. Don't worry. I'm going to answer this question about whitening. I'm just nervous what's going to happen in 30 seconds. All right, let's start the whitening question. So don't power through. Say you're using whitening strips. You have sensitive teeth. My first advice is maybe do it every other day. Don't do it every day. If it says to hold it on your teeth for 20 minutes, whatever it says, maybe start with 10 minutes. Don't like do the full thing. You know what I'm saying? Because you can why? Just baby steps. See how much whitening you can handle. Another thing, very important, I always use sensitivity toothpaste while I'm doing my whitening treatment. So say I'm whitening for a whole week, I'll be using some sensitivity toothpaste as well. Uh-oh. Ads. I don't know what that means. So can you still hear me right now? Someone tell me if you can hear me. I only keep talking if there's an ad playing or something. You would think the ad would be okay, it says no, they're all saying yes, no ads playing. Okay, thank you. I don't know what that meant. I was like, why did it say ads are playing? Okay. Thank you all. Oh, thank you all. Thank you. Okay. So yes, thank you. Oh, I love you all. This is making me feel so happy. Okay. Whew, back to the sensitivity. Sorry. Yes. So every other day, something like that. Don't use too much. Just see how it goes. Also, sensitivity toothpaste throughout. I also use a sensitivity mouthwash sometimes. I'm just trying to prevent sensitivity, but if you know you already have sensitive teeth, whitening product is only going to make them more sensitive. So remember that when you're whitening. If you're really struggling with the strips, maybe ask at your dental office if they have any sensitivity trays for you. So like the custom trays, I've talked about those where you could put the whitening product in the custom trays. Some offices will offer custom trays that you can put sensitivity like product in the trays. So you whiten and then you sorry, I need to stop reading this. So you whiten and then you do the sensitive after. So there's ways around it if you want to whiten your teeth, but don't use sensitivity toothpaste. Or oh my gosh, don't use whitening toothpaste if you have sensitive teeth. Use sensitivity toothpaste and then use using the whitening toothpaste is like way too much. Okay, I'm seeing these things. I need to answer these really nice JT, you're so passionate about teeth and dentistry. Why teeth specifically? What sparks such a passion in teeth to create a career out of it? Did you even love teeth as a kid? Yes, yes, and yes. I was a kid pulling out all my teeth. If my tooth was a little bit loose as a kid, I was yanking it out. I had like no teeth in my mouth for a little bit. I was just so excited. I was like, I want to be a dentist. Is it Rudolph, that movie, that little Christmas movie when you're a kid? That little kid who's like, or that elf, maybe. I want to be a dentist. I was like, I would wanted to be that elf. Yes. So why teeth? I don't know. I also really liked going to the dentist as a kid. My dentist, she was young at the time, like probably right out of school. She was a younger, cool, hip girl. And I was a little girl and I thought she was so cool. And truly, I just wanted to be like her. And I'm like, I want to be like her. I'm going to be a dentist. Like, I'm sure that somehow subconsciously was in there too. Like, I want to be like her. And then I started realizing I really do like teeth. And then I started realizing, I'm not too bad at science and blah, blah, blah. And the rest was history. So yes, I always had a passion. Thank you, JT. I have another one, these ones that are popping up so bright. Whitney, Ryan Brown, thank you so much. This is so nice of you all. Ryan Brown, Whitney, I just recently found your channel. I watched one of your videos where you discussed the fear of going to the dentist and being judged. My teeth aren't perfect. I feel guilty. Nope. Here we go. Ryan Brown, no worries. I'm going to tell you right now, this is so genuine that two things. One, when I get someone who tells me like, oh, my teeth aren't good, you're always harder on yourself. We're always our own worst critics. Do you know what I mean? Just because you think your teeth aren't bad or aren't perfect, how you said it, don't worry about it. They're probably not. We've seen worse. Don't worry about it. And two, even if we have seen worse, we love it because we love helping you. That is our job. I know you said you probably watched the video, so I'm probably saying whatever I said in that video. But I really genuinely, when someone comes in and they're ashamed of their teeth, I'm like, no worries. That's why you're here. Let's change that. Let's see what you need. First, we go through all the health stuff. Do you have cavities? Do you have gum disease? Let's make you healthy. And after we make you healthy, now how else can we help you? Do you not like the shade of white? Are they a little crooked? Do you not like the appearance? Then we'll go through all the cosmetic things. We're here to help you. That's our job. Never feel guilty. You're our patient. We're here to, you know what I mean? I don't want to say it's like a smile makeover, but it could be, right? Like the makeover like type things, like that's so satisfying for us to make you go home with a happy smile. So please know, just please know that there's nothing to be ashamed of or judge. We would never judge you. That's what we're there for, is to help you. So Ryan, thank you. And don't worry, when I get my nails done, I know this is not comparable, but like when I get my nails, by the way, last time I got my nails done was probably my wedding 2 years ago. So, but the few times I do get my nails done, now I'm like afraid to show you my hands. I'm always like, I don't want to go in. Like I'm so nervous. I have the worst, like I have like old lady hands. Someone told me to type in Sarah Jessica Parker. I've told people how like weird I am about my hands and I feel like they make me look old and blah, blah, blah. Someone told me, don't worry, type in Sarah Jessica Parker hands. Then you won't feel bad about your hands. And I was like, what? And so I typed them in and I was like, okay, she's just got like veins and stuff. They're not that bad, but like, anyway, then I got even more stressed because I was like, great, one day they're going to be like, type in Teeth Talk Girl's hands. Like if my hands are ever shown, like do it. And I'm like, oh my goodness, my hands are going to be, so don't worry. I feel judged too. And then I think And I'm like, no, there's people that have, don't worry about it. They're here to help me and they're here to make my nails look good. They don't want to make them look worse. They want to make them look good. So anyway, sorry, I keep talking about it. I just feel so much for you. Uh-oh. Okay, so one second. One when Zany, I love it. Thank you so much. You gave me this really nice donation, but your question isn't with it. So I gotta find your question. Oh, here's the question. Okay, don't worry, we got it. Would you fill wisdom teeth or pull them? Okay, Zany. I'm not a dentist. However, I will tell you what most dentists would probably say from my experience of working with them. Well, they would probably say, go visit an oral surgeon, and the oral surgeon is the specialist. So this is so, I just want to, it's like the hygienist, the dentist, the oral surgeon. So I'm very low on the totem pole of helping you make these decisions. However, it depends. I have seen some patients with fillings on their wisdom teeth, but I would say 99% of the time you want to pull them. I mean, again, I am not an oral surgeon. Ask your oral surgeon. Maybe you have some different circumstances where maybe you're missing your first or second molars. Maybe you really do use your wisdom teeth to chew. Most people don't. Most of the time, you can barely reach back there. They're just plaque traps. You're not using them to chew. Why do you, if you have cavities on them, why save them if you don't use them? You're just going to have to keep working on cleaning them and have to work on keep chewing them. I have a piece of hair. Don't you hate when a piece of hair comes? Sorry. So that's my point, is what I usually tell my patients that ask me, should I get fillings? Or there's some unique circumstances where fillings might be okay on wisdom teeth, but most of the time you would just want to pull them. But always ask your oral surgeon, what they think is best for you. There are also times when maybe your wisdom tooth is on a nerve. If it's sitting on a specific nerve, the IA, inferior alveolar nerve, sometimes it sits on that nerve, and if it does, they might not want a chance pulling it. So there are like some circumstances that you don't want to pull it. So it was a good question though. That was good. Good thing I'm like warmed up for that one, right? No, that's a very good question. Thank you, Zany. I feel like there's one more that like got really bright. I don't know. If I missed it, let me know. But okay. 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 I got so many questions here. I love it. This is so fun. I would talk to you all. Okay, okay. Would you recommend running fox? And I love the picture of the fox, running fox. Okay. Would you recommend rinsing with diluted hydrogen peroxide? If so, what dilution percentage and what circumstances are best? Okay. I would say general advice is no, nobody needs to be rinsing with hydrogen peroxide, just because more often than not, you're going to be killing all the good bacteria and all the bad bacteria. We don't want to be killing the good bacteria, right? And I know you asked about the percentages, and yes, when you dilute it, you're less likely to be like killing off bacteria, but then you're also less likely to be killing off the bad. So it's kind of like, why are you doing it? Some people do it for whitening. Does it work? Not really. Some people swear by it, but there's really no research showing it. My thing is, I don't want to be killing off any good bacterial flora in my mouth, so I would never rinse with hydrogen peroxide. But there was more and more question to it. It said something like, sorry, it like goes away after I read it. You asked something like, oh, 1 second. Excuse me. You asked something like, when would it be a good idea to rinse with hydrogen peroxide? A good example is like when your dentist tells you to, which I know is like a lame answer, sorry, but like if you just had, sometimes if you had some kind of, here we go, this is easy. This is my road, or my place that I'm in, is doing like a deep cleaning or something. If you had an SRP, or maybe you had some kind of gum procedure, or maybe you just have like a sore in your mouth or something. There's a time and a place to switch with hydrogen peroxide, but your dentist and or dental hygienist will let you know for your individual mouth. It's such an individual thing, but they'll never tell you to do it long term. They'll say like, hey, do it for a week or two, or do it for 10 days. So it's kind of like if something went on that you need to like fix in your mouth. It's kind of like if you like scratched your arm or something and you want to like clean it with some peroxide. You're not going to be like dousing in peroxide for the rest of your life, just once it like heals. So I hope that kind of helps answer. Okay, let's see what else we got. That's a nice one. How often do you wash your hair? This is Moro Artiga 54. How often do you wash your hair? It looks so healthy. Right now, I feel like it does not look healthy, but I am thankful for that comment. And I only wash it once a week. Okay, that nutty pot really, I feel it in my maxillary. It's cleaning. Okay. Thank you. That was very nice, but I only wash it once a week. Yes. Thank you. I wash it after my clinic day. Now that I only work once a week in clinic, in office, I still wear my cap. But like if for some reason I'm like doing an extra day or you know what I mean, I still wash it because people are spitting on me, right? But how long until you graduate? I graduate in May 2024. I have one more semester. Okay, what's this one? There was one. I have like things coming from different places. Oh, I see this one. Sorry, I missed that one. Okay. 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 Any advice for someone with gum disease? Zoe RDH. Okay, Zoe RDH. You're an RDH. So I'm thinking you already know, but you just want to know how to like tell your patients. Okay. What I always tell my patients with gum disease, anyone with gum disease, anyone with gingivitis, anyone with gum situations, I always say the best thing you want is a water flosser and an electric toothbrush. You want that combo. Of course, you want regular traditional string floss as well. Of course, you want a tongue scraper. I can go on and on. But the two like really main things is you want an electric toothbrush to stimulate your gums and you want a water flosser to clean in between your teeth and stimulate your gums. If your gums are bleeding, you have gum disease, you need to be getting in there and like making them. I always compare it to working out, right? If your muscles are weak and they're like they need help, you want to like do planks and push-ups and you want to work out. So when you're working out, you're making yourself healthier. Same thing with your gums. You want to work out your gums with the electric toothbrushes and the water flossers. That's my like holy grail or whatever of dental products for gum disease. But of course, you also want traditional string floss. I tried to, and you also want a tongue scraper because you always want to reduce any type of bacteria in your mouth. Is it normal? Epic Weeb, WEEB, Web, Weeb. I don't know. Epic, Mr. Epic. Is it normal for tongue to have slight bumps at the back? Oh yes, circumvallate papillae. Ah, love that word, circumvallate papillae. Everyone says it different. I say circumvallate, regardless. If you can look all the way back, I do have a video that says like, why are there bumps on my tongue? So if you want to search it, you can. Why are there bumps on my tongue? Circumvallate papillae, there's fungiform papillae, there's all these different filiform papillae, different little bumps on your tongue. And around the bumps, you know, is where your like taste buds are and stuff. But the bumps all the way in the back, if you could stick, I'm like, what did I just eat? Should I be sticking my tongue out right now on Let's live TV here that we're on live TV, my computer. I don't know. Uh, I don't know. I was going to show you back there. If you look in a mirror and maybe like put your phone light on there and really you'll see like bumps on the back and they're thick. Totally normal. Circumvallate papillae. You'll if you didn't know them before, you'll be like, oh wow, I didn't realize I had those. Okay. Have you heard of Lanap? What are your thoughts on choosing this over traditional gum surgery? Not a periodontist. However, if I was, I think Lanap is really, really, really cool. It's a really great procedure. It's a laser. It's using a laser to like remove it's a laser gum treatment if you have gum disease, and it can help grow bone back, which is very controversial, right? It's like, is that a thing? And it's like, I have seen results. So I'm not going off any research or anything. I am not a periodontist. That is a dentist who is a specialist in the gums. So they can help you with that, like if you want to know about all the research of it. But I have seen with one of my bosses does Lanap, and I've seen amazing results. What are your thoughts on choosing this over traditional gum surgery? I think it is such an individual decision because there are even some, the dentist that I work with that does Lanap, that he will say, you're not good for Lanap. We need to do traditional for you. So he determines what is that. You know what I mean? The specialist will determine it. So I can't answer that, but I will say that I have seen great results with the nap. So if someone's telling you to do it, just make sure they are certified and they really went through the training. You don't want anyone to just like be like, oh yeah, I'm going to try a nap on you. Make sure they've done it before and they are good at it. I would always say, that's another thing. I would always say, if you're ever concerned, if there's like your dentist is trying to offer you something new, like not that Lanap's new, it's been around for a long time, but if it's something you haven't heard of and you're like, or even like veneers, anything that you're interested in that's like cosmetic or something, ask to see pictures of what they've done. Ask to see their work. It's just like plastic surgery. If you're about to get plastic surgery or whatever, you want to see how that doctor does their work. You want to see before and afters. So I would say the same if you're doing anything like that with a dentist. Just say, hey, have you done Lynette before? Can I see your before and afters? And they should be able to show you, like, here was the bone before, here was the bone after. They should have x-rays of their patients that they've done it on. Always ask. They would love to show you too, because they want to show off their work. You know what I mean? And then you can decide. If they're like, oh, you're my first one, then maybe think about it. You know what I'm saying? Are you still live? I just joined. I'm live, Yanira. Thank you for being here. Yanira Rodriguez, we are live. Okay. Now. This is so exciting. Okay. There's so many questions. It's like, which, okay, I just want to pick one. I'm just going to pick one, right? Okay. Hi, I'm a second year dental student. Ooh, okay. Samir. Samir. I don't want to say it wrong. That sounds like a really cool name. Samir. If I said it wrong, let me know. Or it's Samar. Either way. No, I think it's Samir. Okay. Hi. Everyone says my last name wrong, DeFogio. So I'm always trying to get everyone else's name right. You know, DeFagio, all these different things. Okay. But it's DeFogio. I'm a second year dental student. What's one thing you wish dental students learned more about before getting into practice? They put a laughing face too. I guess that's so funny. I like that. Of course, the gums. However, I will say I've worked with older dentists. I've worked with younger, newer dentists, and I do feel the newer dentists are learning, or it could just be the people I've worked with. But I feel like they are maybe just very in tune in how important the gums are. I don't think you have to be like amazing at doing SRPs or anything as a dentist, because you're probably not going to be doing them. But I think because you said, what do you wish dental students learn more about? I love this question. This is really cool. And I have to like, that's a good question. Okay. So yes, I think just making sure that they're on the same page is like, it's not just about cavities and fillings and crowns and blah, 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 blah. It's not just about the teeth, like remembering that the gums are the foundation of the mouth, right? Of the teeth. Like without healthy gums, you can't have healthy teeth. You can, but what's the point? Because if your gums are bad, you're going to lose your teeth. You know what I mean? So I'm all about a dentist just being on the same page as me, like gum health. Let's do the SRP before we do this filling, because it's such a small little filling, you know, stuff like that. Obviously, if it's a bombed out tooth, the priority sometimes is the tooth, right? But I just love when dentists, newer students I've noticed, or newer graduates I've noticed, really weigh the pros and cons of like where to start the treatment if we have gum issues and teeth issues. And I always appreciate that. So I like that. Patsy, thank you. Just want to say happy holidays. Happy holidays to you and everyone here. Thank you so much. It's going to be 2024. What is that about? I know everyone's saying because of the pandemic, we lost the years and blah, blah, blah. But also every year you get older, it definitely goes faster too. Okay. Do you have any cool plans for 2024? Thank you for it. That's such a nice, you know what? Graduating with my master's degree. That is my biggest cool plan, I would say, of 2024. I cannot wait. To have that degree. Don't worry, I'm staying a dental hygienist forever. I love being a dental hygienist. It's just to improve my knowledge. It's in health communication. So I will hopefully continue to communicating health and communicating it even better. I have a website, teethtalkgirl.com. I'm really struggling with talking today. My degree's in communication and I can't even, no, my website, teethtalkgirl.com. I just hope to continue making it solid advice as much as I can to, you know, really be the oral health website, a trustworthy informational website for everyone. I think everyone deserves to know about dental health. And if they have a dental health question, to make sure that when they're Googling it, you know, because we're all Googling things. I was Googling the neti pot yesterday when I was trying to figure out how to use the neti pot. And I was like, gosh, I wish I had a friend who's an ENT. You know what I mean? Like, should I Google and find someone who, you know what I mean? You just want to, when you're Googling, you don't know if the advice you're getting is right, you know? So that's my big goal with my 2024 degree, and to continue making teethtalkgirl.com the most trustworthy dental health website. You know, I just want people to feel confident about the information they're getting. So that's a big one of mine, but thank you for asking. Also, you know, I would say 2024. Okay. I was just going to say, I just want to try to remember to live life and stuff, because I'm always like, especially with school, studying. Hold on. I got a cool one. Guy Gentist. I love it. I love a guy dentist. I'm getting my prereqs done and I plan to be a dental hygienist. Any advice? I'm getting my prereqs done. So you're probably about to apply to dental hygiene school because you're going to be a guy dentist. You know what? Any advice? Yes, I do. Okay. Oh, I have an RDH video checklist. Um, Again, I'm not sure. Let me see if I can find the link. I'll put the link in the description. I have an RDH video checklist that I made just for you, hygienist. I'm so happy that I just realized this is all coming together. So I have a lot of people that will say, like, I'm considering dental hygiene school, or I just got in, or whatever part you are, whatever timeline you are on right now. This RDH video checklist runs through what you should be doing on every part of your journey, of your dental hygiene journey. So you're doing your prereqs. So once you go to this video checklist, yes, thank you. I'm going to find the link, and I'll put the link in here in just a second. Can you? Okay. I'm typing it. There it is. Hold on. It's coming up. I just want to do this before you all. So everyone, what I'm putting in there, this is the RDH video checklist. So I'll pin it once I can. I can't pin it because it keeps like doing like an emoji. If I have to wait till it goes up. So there has to be a few more comments. Okay. So my RDH video checklist, like I said, it's basically a timeline, and it helps you go through everything you need. It'll be better to watch a checklist than me to try and checklist it right now because I'm all over the place. But yeah, I really hope it helps you. I worked really hard on this checklist. There's also, like, once you watch the checklist, the video, and you can start it wherever like makes sense for where you are on your journey of the prereqs. But no, I'm so excited for you. I can't wait for you to join our community, hygienist. We love and need more of you, right? I love that. Equal girls and boys, and everyone in the dental field is important. You know, I saw that there was a statistic that there used to be more male dentists than female dentists, and now I think there might be almost, I could be wrong, but it was really close that there might be more so I'm like, yay, like we're all, like, everyone's invited, you know what I mean? Like, we should all, no matter what you identify as, you should, if you're interested in dentistry, whether it's dental hygiene, dental assisting, girl, boy, in between, whatever you are, like, you should do it. So I'm excited for you. What's the difference between a hygienist and a dentist? And is going to just one of them enough? I'm going to pin this comment. Replace. I just replaced my pin comment with the video checklist. Is going to one of them just enough? What was the question? Sorry. Eric Carter. Oh my gosh, Aaron Carter's in my mind, I guess. R.I.P. Okay. And is going to just one of them enough? No. Dentist and dental hygienist, you need to go to both. I know there are dental hygiene clinics, which is so cool, and maybe one day that will be my future. But there's still a dentist that works at a dental hygiene clinic, and the dentist is looking at the x-rays and maybe even get, every clinic works differently, but just because it's a dental hygiene owned clinic and you're going there to get cleanings, there's still a dentist there to diagnose cavities and things like that. So it's important to see both a dentist and a dental hygienist. However, even if you're going to a dental hygiene clinic, you're fine because there's still a dentist reviewing your case. You know what I mean? So what's the difference though? A dentist, it's a 8-year degree, 4 years of undergrad, 4 years of dental school, and you are a doctor of dental. So you're drilling, filling, diagnosing, doing all the restorative stuff. You're restoring broken teeth, you're fixing teeth. Dental hygiene is a 2-year program, but you have to do 2 years before of prerequisites, at least usually. So it's around 4 years usually. Some people might be able to get it done in 3, but I've never met anyone who has. So at least 4 years. Some people will do their bachelor's degree for dental hygiene, so it'll be between 4 and 6 years. Regardless, it's less schooling than 8. And a dental hygienist focuses on prevention. I do have a video. I'm always like, I do, because I'm just thinking about this video, and it's like an 8-minute video where I'm like, oh, we only have a few minutes left, less than 10 minutes. So, but yes, I do have a video that's like, what does a dental hygienist do, or RDH responsibilities. Whenever you're looking for one of my videos on YouTube, just like type in what you think, like the keywords like RDH duties or RDH responsibilities, teeth talk, and you'll find something like that. And if you can't find it on YouTube, you will more easily find it on my website because my website has like a really good search for me, versus like YouTube has a search for everyone, whereas my website has a search only for my videos. So RDH responsibilities, it'll tell you everything a hygienist does because it's not just cleaning teeth, from the beginning of the appointment to the end. You can learn all about that. Thank you all. I love your videos. Thank you for saying that, Kyle and Barbie. Uh-oh, Ryan Brown. Hey, what's with all these miracle toothpastes, Ryan Brown? Are they miracle toothpaste? Are they a miracle toothpaste? And do they really whiten teeth? Also, I now use disclosing tablets because of one of your videos. Yes, disclosing is so cool when you get into it. Like, it does get like a little addicting because you're like, I really want to see how well you like can get competitive with your own self. Like yesterday, I missed the spot. Today, I'm not. I have a video that, again, disclosing. It's called Disclosing and then Teeth Talk. You'll find it all about what disclosing is. But yeah, it basically stains your plaque and then it tells you if you brushed good or not. It's really cool. Anyway, so miracle toothpaste. No, nothing's a miracle. If it was a miracle, we'd all know about it for sure, right? That's what I always say. It's like if something really was, if it's too good to be true, it probably is. If something really worked, wouldn't you? I would, you know what I mean? Everyone would talk about it. Like, hey, this cure in my. So, no, unfortunately, advertisers, they just want to sell their products. Oh, sorry. See, whoever said that my hair looked good today, that's very nice of you because today's not a good hair day for me, I don't think. Anyway, okay. So yeah, miracle toothpaste, no, not a thing. Unfortunately, I know. I have a video coming out soon. I've done a short on YouTube about purple toothpaste. I also did a reel on Instagram, like how purple toothpaste doesn't work, blah, 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 blah. It might work on clear brackets. So if you happen to have braces that are clear, like the clear brackets, and they're like stained a little yellow, if you use the purple toothpaste, it might help with clear brackets. But for your teeth, the people who say it works is because you brush with the purple, you spit, you're like, once you rinse it off, the effects are gone. So they might look like really white for like 1 second. And then because the purple toothpaste, okay, people compare it to when you wash your hair with purple shampoo. When you wash your hair with purple shampoo, it actually chemically bonds with like your hair. So that's the whole thing, right? It soaks in. With your teeth, it can't bond. It just rinses off. So it is a gimmick. I'm sorry if that's the one you're talking about. Yeah, everybody's been asking me about the purple. So I do have a video coming out. I'm editing it right now, and it's on the line. It's on the docket. Okay, I have a few more minutes. Why am I like, you know why I am like this? I'll answer my own question. I'm like, today. This morning, I was on Seattle local news. It was on Zoom, of course, because I'm here in Chicagoland right now. But I was in the morning live, and I was like, ah! And I've been going since then. And I feel like that's why I am the way I am. But I'm so happy to be finishing off my day with you all because you all are so nice to me, and I really appreciate it. And I love talking teeth with you all. Okay. I'm going to realize what you were saying. I love how someone just said Leth. Leith said, I loved disclosing tablets in elementary school. LOL, so motivated to brush. I love it. Okay. Here's a question. I would like to know about Talon cusps. This is a random one for me to pick because Talon cusps, when the little Talon. So if you don't have a Talon cusp, you probably don't know. It's like this little bump on the back of some of your teeth. So when you feel the back of your teeth with your tongue, they're usually smooth, but some people have like a bump on one of their teeth. You'll be like, oh, what's that bump? It's probably a Talon cusp. So what's the question about it? Sorry. I have a very small one that my dentist has never mentioned, so I'm guessing it's okay to keep. Yeah, usually it's just an anatomical variation, right? Some people's teeth just develop differently. And as long as you're keeping it clean, because sometimes there's like a little hump, like a little bump behind your teeth, you just got to clean it really well. Sometimes it can be a plaque trap, and that's the only time we might be concerned. But if your dentist hasn't mentioned it, your dental hygienist hasn't mentioned it, you're probably keeping it clean. So yeah, I wouldn't worry about it. But if you are concerned, just ask them next time. Be like, hey, you already know it's called a Talon cusp, so sounds like you know what you're talking about. But in case you don't, just say, hey, I got this little bump. Just curious. Always ask. Never be afraid if you have a question. Okay. ooh, this, okay. Okay. This is a good, like one of our last ones. I also, okay. Oh, sorry. Who was Talon Cusp? What was your name? Anika. Mizo. Okay. I keep forgetting to say people's names because if I'm asking a question in a live, I want them to know that I asked. Maybe not everyone feels that way though. Maybe you don't. I don't know. Whatever. I like saying your name. If you don't want me to say your name, don't say my name. Okay. Ash, Ash, 8143. Ash RB. I also had a question about permanent retainers. Are they okay to have on? Do they create any issues over time? Would you suggest getting rid of them and using temporary? Okay, permanent retainers. So you all know when there's that little bar on the back of your teeth and it's permanent. You usually get them after you had braces. Some people get those. I always do this. I like give options with my hands. Some people get the permanent retainers where it's cemented on your teeth. Some people get the removable retainers where it looks like those little like trays, those, clear plastic aligners. And some people are told to take them in and out at night. Your orthodontist is the one to determine which one they feel is best for your individual mouth. But on that note, if you really want one over the other, you can push for it. You can advocate for yourself. Be like, hey, okay, but the question is it okay to have them on? Absolutely. It's a great way to keep your teeth in line. You need something to hold your teeth in place after braces or after clear aligners. After your journey of straightening your teeth, you want to keep them straight. So whether it's the permanent retainer, then you don't have to worry about it, or if it's the ones that come in and out, you have to remember to wear them at night. So you know yourself best. If you forget to wear them at night, like if you're someone who's like, oh, I'm never going to remember, have them cemented on, right? Yes, it will be harder to clean around because it's now cemented and now it's going to be kind of a pain to clean. But I think if you're not going to wear it at night, it's you paid so much money for those braces. You need to keep them straight. So yes, they're fine. You just have to work harder to clean them. You can use a water flosser. You can use those little interdental brushes to clean around them. I did just film a video, but I got a lot of videos on the radar coming up. I have an old video on how to clean between the permanent retainers, but I have an updated one coming soon because I had blonde hair in that video, and that just shows how old it was because I had blonde hair in 2017. So I made a new updated one. So yes, permanent retainers, they are fine, but I personally had a permanent retainer and I asked my dentist to remove it because I am a dental hygienist and I got to put on as a kid. And, they do assume that most kids are not compliant and are going to forget to put their retainer on at night when they go to sleep. So that's why they do usually cement it on a lot of kids. But if you're an adult ortho and you think you're going to be fine putting your retainer in and out, you'll be fine. Either way is fine. Just make sure you clean around your teeth. And I think, should I do one more question? Because I'm about to go. Oh, good night, Patsy. Thank you so much for being here. I think I'll do one more question and then we're going to get going because it's getting late. Oh my goodness. It's so hard to pick the last question. Don't you think? It's like hard. Okay, I'm going to do I'm just going to do this with my mouse and see what the last question is. And okay. Lauren O. I feel like there's plaque left over after I use the Cavitron. Any tips? So, Lauren, I'm thinking you are a dental hygienist or dentist. I'm assuming dental hygienist. Okay. There's plaque left over when you use the ultrasonic. Yeah, no problem. I'm constantly, I thought this was the same person. Well, my answer to that would be, don't worry about it because you're going to go back and hand scale, of course, right? It did take me a while to get really good at the ultrasonic, Cavitron, piezo, whatever you want to call it, right? I'm not gonna lie, I felt like I would hand scale at the beginning a lot more than I would ultrasonic scale because I just felt very comfortable. We learn how to hand scale, like they jam in the hand scaling in dental hygiene school. So you're very good at hand scaling when you're done. And I feel like we personally didn't use ultrasonic as much. So I was so comfortable hand scaling. So I would just ultrasonic, you make sure I get it if there's any little pockets, but I would say that'll hurt your hands over time. So just the more you use, my best advice is the more practice makes perfect. I don't know how long you've been working. So if you've been working for a while and it's still not working out for you, my best advice is to go over it a few times, right? I always think about this too. When I'm hand scaling, you have to sometimes clean that same tooth. Like you need to get all that tartar off. It takes time. But in my mind, when I'm using the ultrasonic, I just go around from tooth to tooth. And I'm like, no, you could go over it a couple times too. Sometimes it takes a couple strokes, you know? So I hope that was a good answer. But thank you for everyone. Thank you for all the dental professionals here. Thank you for all the teeth and tooth enthusiasts here, patients, people who are interested in teeth. Thank you for caring about your teeth because it means so much to know that we have a whole dental health channel here. All of us care about improving our dental health. And that is so cool. So thank you all. Stay healthy. Enjoy your holidays. Happy holidays. Happy 2024. I can't wait to have an amazing year with you all. Well, of course, we have the rest of this whole month of videos. I have a fun video every Tuesday and Thursday here on YouTube. I also have been posting a short every single day as well. So, and of course, follow me on Instagram at Teeth Talk Girl. If you ever want to DM me, if you have any more questions that I didn't get over today, or you can DM me and we'll put them on a list to answer in the next live. So thank you all so much for being here. Happy holidays. Peace, love, and teeth. Truly, I can't say how much I appreciate you all. Thank you so much.